Hi, thanks for joining us. It's a pleasure to talk to you today. I found out, great. I found out from your network that you were also in Harvard. Maybe you want to just introduce you and then we can go from there.
Sure. I'm a biologist by training. I studied at Hacettepe University in Turkey, Ankara. And then I moved to my master's degree position at Bilkent University, again in Ankara, Turkey. After that, I moved to University of Massachusetts Medical School for my PhD position, working on cell biology and molecular mechanisms underlying different diseases and differentiation pathways. Then I moved to Harvard University, working on different RNA molecules called long non-coding RNAs that are underlying disease pathways as well. Now I'm currently at University of Toronto, working on the molecular mechanisms underlying autism spectrum disorder.
This is actually very interesting for us because I just want to introduce myself for all those who don't know our talks yet. I'm a psychiatrist, I'm a psychotherapist, I'm the head of a healthcare center in Munich, in Germany, but I was also in Harvard much earlier than you because you're younger than me. But I did my doctoral thesis in Harvard, and then I also did a master's of public health. And I lived there around 3 years, around 2000. And now I'm a psychiatrist, and autism is something actually rather new. We just get used to it. The last 10 years, we have more and more cases presented to us as attendings, as chiefs, and our residents try to gather all the information, and then we try to do the therapy. What do you want to say about the latest news of research about that?
In terms of autism spectrum disorder, our laboratory has recently found a molecular pathway. In the human cell, there is a mechanism called alternative splicing, where from one single gene, you can actually emanate different proteins by including or excluding this parts of gene. Our laboratory, the professor that I'm working with, Dr. Benjamin Blanco, uncovered a protein that is downregulated or reduced in autistic patients. This results in a whole plethora of differential protein expression in the human brain. And actually, our recent studies show that in mice, when we ectopically decrease the levels of this protein, the mice show different phenotypes mimicking the autistic phenotypes, such as different cortical layering, changes in social behavior, etc. Currently, we are working on finding different chemicals to restore this protein, which is actually mutated in around 30% of the autism spectrum patients. So we are focusing our efforts on uncovering further mechanisms of that protein.
Oh, very great. So what do you think in general about genetical therapeutic mechanisms, like finding drugs or finding ways to, well, would you describe it, please, in a rather understandable way, because not everybody is a physician who listens to us.
Sure. So there are many clinical trials going on if you look at different databases. One common theme is that I think we as scientists are kind of falling behind, is many of those drugs are trying to alleviate the diagnosis of the patients. They are aimed at not necessarily to cure the underlying basis of the disease, but rather they are trying to cure the outcomes of the disease, which may potentially better benefit the patient.
Manage the symptoms, we would say.
Yes, the symptoms, exactly. That's why there are many both psychiatric and psychological treatments as well as clinical trials. So I think combination of those both therapies would best benefit the patients in the long run, and there's a great effort going on right now.
How did you like living in Boston? How did you like being there? How did you experience the science there and the people living there?
I arrived in Massachusetts in 2008, and right after my master's degree at University. It was my actually first time being in the United States, and I've been to Europe previously, and it was a big experience. What I've noticed over time is the United States is a big country, right? It's almost a continent. So every part of the United States can be considered as a different country because of their unique culture, unique habits, etc. Boston in general, I think, is a bubble basically, because once you get, it's a very liberal place, people are open-minded, and there's great science going on, obviously. However, once you get out of Boston, it's a slightly different world, and that's what I think is a bubble in general.
You're very kind. You say slightly. It's a great different word. But yeah. I mean, I actually loved it there. I lived in different parts of this area. It's not just Boston. It's Brookline. It's Allston. I lived in Allston when I arrived there because it was the cheapest place to be. A lot of students, a lot of live music, very bad housing, but affordable and not far from medical school. And then I moved to a very luxurious apartment with several friends in Brookline, very near to school and very nice neighborhood. Everything is beautiful, and things are more expensive and so on. Boston itself is so colorful and has so different parts of it. Then I was in Cambridge for a long time. I lived in Cambridge. Where are you? And now you're not there anymore. You're.
We lived in Cambridge for my postdoctoral studies, and we knew we were going to live in downtown Boston, either Cambridge or Boston, for a very limited of time. So with my wife, we decided, let's just, pay the rent and then stay at a nice place. So we lived in Cambridge. It was great. It was great walking around the Charles River and cycling over there. And But my wife was graduating from her PhD, and I was 2 years ahead of her. We always had this two-body problem. One had to find a job first, and the other one has to follow him or her. We were provided an opportunity to synergize together while keeping research programs together. And that's why we decided to move to Canada, to Toronto.
Yeah, that's also a great place. So I think probably now nicer than the US. But how do you cope with Corona in Canada? Do you have I don't think you have so many cases compared to the US, or does it swap over to you?
No, the first thing is since middle March, Canada has closed its borders along with the US. So there is no non-essential, the non-essential traffic is banned if you cannot go as a visitor or as a tourist. Canada has done relatively well in terms of coronavirus containment. We are not as good as, let's say, New Zealand, for instance, but we are not as bad as Italy or United States. And currently, the Canadian government has further extended the ban on the border closure until the end of November to basically avoid any spillage from the United States into Canada. However, as the flu season is coming, as seen in every place, Canada is seeing a slight uptick of daily cases.
Yeah, our wave is now increasing again because we have so many people returning from vacation, also from Spain, from party locations. And then we also have people who are not so concerned anymore as they used to be months ago. I guess you probably have the same problem that people are tired of following all the rules, right?
Actually, speaking about Corona, and as it is within your expertise, another, a bigger aspect of coronavirus, apart from the viral infection and the symptoms associated with it, is the mental health of people, of the general public.
Yeah.
Right? Because it started in March, which was late, early spring perhaps, people were still contained at homes and they could barely make it till the end of April, which then the summer hit, which was a great time because they could go out, enjoy themselves, etc. But right now it's lockdown time again back home. It's getting colder, especially in Canada right now. So there is a statistic saying that for Health Canada services, there are some phone lines where people can call about their mental health, etc. It's a free government service. The calls have been increased significantly.
I think also suicidal rate went up. I've seen several articles about high infection areas in the US where a lot of people try to commit suicide. Maybe they feel they are, for example, responsible for the death of somebody or several people, or they feel like they can't bear the situation anymore, or they are totally insecure of how their life will go on from now on, or they lost their job, or several horrible things accompanying this pandemic. And so I think, I don't know, Canada probably also has a much better social security system, right? Similar to Europe, we try to give people support when they are not able to go to work anymore. We had a lot of home office opportunities now. Actually, I started my talks with the beginning of the pandemic because I usually invite interesting people to our healthcare center and talk about all sorts of different interesting topics, and then they couldn't come anymore. After we canceled the fourth meeting, we said, why don't we do it over Zoom? And then we are totally surprised and happy about the very positive feedback. People are listening to the talks and giving feedback, and so we decided to do it as long as possible, and are very happy to come closer with colleagues in Canada, which is not really where we fish for our for our guests usually. So and say it again.
It's a great platform to put every.
The world is coming closer, which is great, and also scientific exchange is getting much better than it used to be, and people are more helpful as far as I experience it. And we in Germany seem to be very well coping with Corona so far, and hope we can extend our responsibility and our following the rules until we get the vaccination. What do you think about the vaccine? Do you follow the latest news about it?
Yes, so the Canadian government signed 4 contracts with some private US companies because most of these companies, such as Moderna or Pfizer, are in phase 3 of their vaccine trials. And Canada basically wanted to guarantee a certain number of vaccines for its own population if it gets approved beforehand. And there's also a number of vaccine trials going on in different universities across Canada as well. The question will be, there are different phases of individuals who will get the vaccine in order. For example, frontline workers at hospitals, etc., will be vaccinated first because they are most prone to contracting the coronavirus. Whereas senior people or people with underlying complications will be the second phase, for instance. There are 4 phases where the last phase will be adult, healthy people, where you don't have any complications. You will be the last to get it. And that makes sense, basically.
Yeah, obviously that makes sense. And we in the European Union even collected like 8 billion euro to try to really give it to everybody, to give it also to the poor in Africa and to Asia and so on, try to sort of look at the big picture globally and not just provide it for our own citizens in Germany. Do you have a very difficult problem with racism, with right-wing?
No. I mean, there are some very minor issues, I would say, but regardless whether the current government is liberal or the previous government who was conservative, Canada has been always pro-immigrant, and basically there's no place for racism or hatred along any religion, any race in Canada. And it's been publicly voiced at every level of the government, as well as, most importantly, the media itself. And you previously asked me questions about the differences between United States and Canada. One difference was outside the Boston bubble. Whenever we were traveling anywhere, just going into the grocery store, for example, the first question when I say hi, the first question I was asked was, where are you from? And I don't mind it. Sure, I'm from Turkey, and we chat. They will say my relatives visited Turkey at this year, etc. One difference we noticed is in Canada, nobody asks you where you are from. You're in Canada, you're at the present, you're here, and it doesn't matter where you are from, unless there's a conversation that directly links you to somewhere. Of course, they would ask it, but it's not a first-time question that you are asked when you encounter somebody. And that actually tells, it's a very subtle difference, but that tells a lot about the mindset of the general public.
Exactly. And the interesting thing, I grew up in Germany. I was actually made in Germany. I was born in Istanbul, and then I came back to Germany when I was 1 year old. My mother decided to permanently stay here. So I feel German with a very rich and I'm very proud of my Turkish background, and I speak Turkish well, and I try to never lose track of what's going on in Turkey. But I grew up in Germany. I lived in the States for 3 years. When I grew up in Germany, it was still the 70s, 80s. We had a lot of discrimination. Even the good ones, if you didn't have a German passport, you couldn't apply for several, let's say, stipends at the university, or you had several visa issues when you were around, traveling around in Europe and so on. I mean, most of it is solved now, but it was difficult. And when I went to New York, I lived first in New York for half a year. I did an internship at one of the teaching hospitals of the Mount Sinai School, and I was in the middle of Manhattan. And this, what you just described, I experienced there. They never asked me why I might have an accent in English or where I'm from, or they just accepted me the way I was. I think in the States, at least in New York and Boston, where I used to live, they want you to be successful. That's what the immigrant society expects from you. You're here, you have to use your possibilities, you have to function, you should be nice. And at a certain level, I still have friends from all over the world. I studied with in Boston. We keep in contact over Facebook or some other networks, and it was a really nice experience.
New York is one of the most cosmopolitan cities in the world, so I am not surprised that there's no discrimination or anything like that.
Boston was actually so nice because I met so many interesting Turks from Turkey who came directly from Turkey, not from Germany. And I think I was one of the first Germans actually to go to Harvard from Germany. And the Turks from Turkey were very well educated, very modern, very different than people who live in diaspora, who tend to be more conservative, to stick to the virtues and values they had when they immigrated in the 60s, 70s. So I was very pleased to meet all these friends from Turkey, and then I started to be very interested again in Turkish culture, in the language, in the homeland from my parents. Actually, I was never living there. So yeah, I don't know. I mean, we are Earth citizens, as you said.
There is actually a study by the social department here at University of Toronto, and that professor analyzed the race profile, I shouldn't say race, but nationality profile of different startup companies, both in the US, in Europe, and here. The thing is, the more diversified the workers are in that startup, he focused on biotech companies. The more diversified the people, the employee in a startup company is, the more successful it gets in terms of, let's say, growth or in general success. That actually brings a lot of things, because every nation has a different education system, and it has flaws and strengths of different parts. For example, some countries are great in math, some are great in, let's say, arts, the others are more in social problems, etc. When you bring people from all different parts of the world, different strengths are shined, which are culminated together to ultimately achieve a general good or success.
Yeah, that's great, a great example. You should send me these studies, because right now we want to work on discrimination and racism issues who immigrants in Germany who are actually treated at our institution are facing. So we're handing out questionnaires, but also to the second wave of well-educated young immigrants from Turkey. And we want to compare how people feel who are very well educated and have a very good job. They came and had right away language skills and good jobs and good salaries. Do they also feel discriminated? Or this is one research topic we have. And another one, obviously, is COVID-19 and the mental issues accompanying it. And also, is there a difference between Germans and between immigrants? Because I found out that a lot of immigrants had really big issues with the borders being closed. They were quite afraid of what's going to happen to them. What if they die? What if they don't get treated here because there's only a limited amount of resources? Will they be treated less, or will they even be? Some had really horrible theories about being deported and about whatever if it gets tough, that they will be in a very bad position. And some of them still don't speak enough German, so they always listen to the media in Turkey, and they don't actually know much about what's going on here. I mean, I don't want to exaggerate, but there are still people who are in their diaspora bubble. And
same in the States and Canada as well. There are some people who've been living here but cannot speak in English, for example, because they've been in their own bubble, family bubble or friends bubble for 20 years or so.
Do you have a Turkish little Turkey in Toronto? Do you have an area where you have all these Turkish restaurants? And
there are some Turkish restaurants. We have a few friends here, but most of our friends are spread all over the world, basically.
No, I mean, do you have like a little Italy in Manhattan or Chinatown? Do you have anything like that in Canada and Toronto? Is there enough?
There are not enough of us here, probably.
Okay. So you're the first ones. You have to increase our amount.
Actually, the funny thing is, when I first moved to Toronto in 2018, I rented a place in a place called Little Portugal.
Oh,
and
yeah.
it was a little diaspora of their own kind. And I actually learned some like basic Portuguese. I was starting to learn the bakery, etc.
So where are you from in Turkey? Where did you grow up?
I was born and I grew up I was born in Tarsus, İçel, and I grew up in Adana.
Okay.
And then I moved to university to Ankara.
Do you have difficulties? I read once it's a bit difficult with the Francophone and the English. Is there like very big culture differences? Do they get along? Does that work?
They mostly get along. It's actually a topic of comics and jokes mostly between Francophones and English. Me and my wife speak basic French as well, so we can get along in our daily lives. I think Montreal is still very bilingual. You can easily get away with speaking only English in Montreal. Mm-hmm. But if you go to either rural Quebec or north to Quebec City, for example, which is called the National Capital area, the capital of Quebec, basically, they are mostly Francophone. And but if you go as a tourist, you won't have any problems. But we actually have been studying some French just to get along during our daily lives, and it has helped a lot.
What are your hobbies? What do you like?
We still do a lot of rock climbing.
Oh, great. Oh, okay.
And at some time, especially when we were in Boston, we used to do a lot of tango dancing.
Oh, nice.
So life was good. Life is still good.
Great, great. What do you want to know about us?
You have a very interesting niche in your area. You're not only a psychiatrist and the head of the department. You also are very active in terms of immigration, public health as well. And so one question that I would like to ask is, it's been a lot on the news in Canada, especially when this coronavirus hit. In Canada, regardless of the city, the neighborhoods with lower socioeconomic income or status were hit, regardless of the nationality or race, were hit harder by the coronavirus because they weren't able to self-isolate. People were ordered to stay home, but if one person doesn't have enough funds and living in a basement apartment, for example, how long can they stay in their home, etc. I'm wondering whether the same social inequality showed this difference within the coronavirus pandemic in Germany as well.
We don't have the facts yet. I think immigrants were hit harder because their social status is lower. I was the only Turkish-speaking psychiatrist with a practice in Munich. So my practice was full of Turks. They came from outside Munich, 200 kilometers, 100 kilometers was no distance for them. And they really needed somebody who knows about their cultural background, about their needs, about their problems, and felt or had the impression that a physician with Turkish background is more loyal to their needs, understands their problems more. So I was totally overcrowded and I had to grow. Now we're 7 attendings and 4 residents. We have a huge center. I'm still the owner and head of the center. And we even opened up a second one. We talk 10 languages, not just Turkish. We have Russian, people from Poland are treated, Greek people. What else do we have? Obviously French, English, and so on, but it's Iranian, Farsi. We have a person from Afghanistan working with us, Russian, Azerbaijan, and so on, from Georgia. And the thing is that immigrants have difficulties following the rules because I think they have other customs, they have other ways of living together. We have now 70% more traveling around than we used to at the beginning of the coronavirus pandemic, where we were locked up at home. We were actually not locked up like in Turkey. 65 plus people couldn't even leave their house, which was, I think, way too much. But we had people in nursing homes, in elderly homes who were basically also locked up in their apartments. They couldn't receive any visitors anymore. Even we doctors who were treating them couldn't go to them. We were informed about their problems. So I think low social income is a predictor of a lot of diseases. And it's not just COVID-19, it's not just the coronavirus and its horrible effects. It's, I think, also obesity, diabetes, a lot of other things. We have in Germany young people from Turkey, basically men who don't drink that much alcohol. It's more Russians or people from the Eastern world who drink more alcohol, but we have them consuming cannabis, what do you say, marijuana in, I think you say in English, and they, if they consume it too much in too young ages, they have schizophrenia as an outcome, or other severe health problems. We can see that people who are not well educated and who are not using the healthcare services as provided, because they might even think it costs money, or they might even not know about it. They have a way worse healthcare situation. And I think that's what you described now, that in these areas, maybe there are not so many practices because there are not so many rich people who can pay a lot for their treatment. Private practices tend to be in rich areas. Then they might have maybe not be insured. I don't know how Canada is. In Germany, also the poor all have healthcare insurance. Yeah, and I think you're similar. So that's not the issue, but a lot of people, they tend to not go to the doctors because they are not used to it. They don't know. A lot of people don't speak enough German. So when I was still a resident at the hospital, and I started then already, I started ambulatory treatment unit. And when they found out, they found out very fast that there is a Turkish-speaking doctor, and they came like a big wave. And before, we didn't have many Turks at this psychiatric hospital. We have an amount of 20% immigrants in Germany, but we used to then, I know the numbers from then in the hospitals, only have 6% immigrants in the services. So you ask yourself, where are they when they have problems? They are not treated in many ways. We had actually a big emigration issue of our German doctors at some point when I was just in my last years of residency. The doctors did strike the first time in their lifetime in Germany because they had very bad working conditions. They were not paid at all for overtime or for this weekend services at the hospital, overnight shifts and so on. And then a lot of them decided to go to United Kingdom or to Scandinavia. And that was interesting that I think in other countries, in the UK, they say we have more foreign doctors than we have foreign patients. So, and now we have the same problem. I am always trying to get Turkish-speaking doctors. So if you know anybody in Turkey who is good, please send them to us. But they make it more and more difficult for us, which makes me very angry, to get a working permit for them. They have to pass different language skill and medical skill tests and so on. And it's very difficult. They have to actually have already enough money to survive until they get this working permit, or go back to Turkey and then come back and do the testing and so on, which is really not understandable because we have not enough doctors. I don't know how your situation in Canada is. In Germany, we don't have enough doctors for all the treatments we have to deliver. We have a lackage of medical personnel.
Canada is an interesting example because it has enough doctors, but in large cities, for example, in Toronto or Vancouver, for example, the number of hospitals is not increasing consistent with the population growth. So there are not now new initiatives to increase the hospitals around big cities, but the number of doctors is actually sufficient. I would like to point out one interesting fact that Canada did. During the early days of the pandemic, for some reason, there weren't enough frontline workers, nurses, etc., or people helping in the emergency rooms. So what they did is they looked at the immigrant population. If you have a MD degree or a nurse degree from another country, but you don't have the equivalency of Canada because you have to take 3 different examinations to have the equivalency of, let's say, being a nurse or a doctor as your own country. They allow these people to work in the hospital setting under a licensed clinician during the pandemic era in early March and April, basically. That actually has helped to put the numbers down quite a bit and increase the testing speed, etc. But those didn't count as a clinical experience for these people. They still had to go through but it was an interesting example of how Canada used its skill and labor force that was basically on backup in need of emergency.
Exactly, we had this too, but you don't know who gets this permit and who doesn't. It's really
behind the
doors. Not transparent. And I'm not sure how it's probably just limited for a certain amount of time, right?
Yes.
For like a year or so, they get this experience, but maybe then they feel confident enough to pass the tests.
Maybe,
That's
or
actually
maybe
a good experience.
Maybe they will get a reference letter which will put their CV forward, etc. With this coronavirus, I want to talk about how coronavirus make the humanity realize certain problems, both at the individual level, at the societal and international level as well. And so I would like to tell Canada's experience, or from my experience being in Canada, and I would like to ask if it holds true in Germany as well. One thing that people realized is after the lockdown began, how crazy the daily schedules are in everybody's life, in this working 9 to 5 schedule, 5 days a week, 2 days of weekends. Many people work over the weekends as well. That some people wake up at 6 a.m., dress, and just dressing, commuting to work, starting to work, commuting back. Actually, many people spend maybe 1/5 of their days just to prepare for work and coming back from work.
Yeah.
Having started working from home, what people realized is that we can mostly do this in general, because you wake up, you change your clothes, you have your breakfast, and you're ready to work. You don't have to commute to work. You don't have to prepare food. I sometimes bring my lunch to work, for example. So it was kind of a realization of how important time is and being close to our loved ones in general. So I would like to ask, based on your experiences from your patients or the discussions in Germany, was it the same way, or are people still, we are still working hard, but from home?
I think it's very easy to do home office and also homeschooling to help the children with their homework and so on, and with their digitalized schoolwork. When you have enough, let's say, education, when you have a high drive, I think it's not so easy for the ones who have lower quality jobs. and who have to be somewhere to put together cars or to clean something or to prepare the food for some companies' lunchtime and so on. It's very good for people who have a high drive doing their job, who are highly qualified, that working from home, as for example, my husband and I did way more than before. And we had the same experience as you said. We didn't have to take care of children, which was a very big advantage. I have friends, especially women, had a lot of trouble during Corona times because the children were always coming to them, wanted to have help with something or wanted them to play, but they had also they had to function 8 hours in their home office, and they had to cook because they couldn't order from outside. They had way more jobs to do. They had to bring the children to the kindergarten or to school and pick them up later on. That was not so good for women, as we heard from people who did studies about it. But it's a big chance to rethink our ways of working and to give other opportunities to highly skilled workers, to employees, to at least maybe have 2 or 3 days in home office when their performance doesn't decrease. Because they gain, like I don't know how far you have got to your work environment, but my husband has like 45 minutes one way to commute. I am very near to my center, but I have friends in Istanbul who had to go 1.5 hours one way, and now they gained like 3 hours for their private life because they were working from home. And suddenly it was possible even to do conferences. Last week we had the ECNP conference in Europe. Usually it's a European conference in neuropsychiatry. And we had 2 posters to present, and we did everything via Zoom. And it was just as good as standing there. I mean, okay, you don't have this interaction with other researchers, and you don't have these nice chats in the evenings and the dinners together and the informal exchange, and also the wonderful sightseeing in some beautiful European city. But it was possible to exchange without being somewhere. And that's actually something, as you mentioned, which I really also enjoyed. And I think we have to rethink our daily routine. There are a lot of things I'm missing. I gained weight because my healthcare fitness center, my fitness center was closed, and we couldn't really work out as we were used to. And we had other things that we don't like. We like to go out for dinner. All the restaurants were closed, which was horrible. We couldn't meet friends as we usually do. But now everything is back to normal. We can meet friends. We have restaurants open until 11 p.m. in Germany.
The other thing that I would like to ask in terms of politics is that this coronavirus pandemic, I think, allowed nations, each individual country, realize how important science is. Because previously, the European Union, United States, NIH, Canada, scientists each year begged for money. You have to fund science. You have to fund science. And sure, it was funded at an okay level, perhaps not as much as many militaries, for instance, or other aspects. But when this coronavirus hit, it was noted that this coronavirus family, the virology studies of this coronavirus family were limited compared to other viruses, which basically made humanity in general unprepared for such a big infection, because before creating any prevention for this disease, we didn't know how the biology worked of this virus. Thankfully, with the technologies that we have all over the world, there was an unprecedented study on coronaviruses. Each laboratory, even if they didn't work on coronaviruses, switched their focus to study some aspect of it. And as a humanity, in 1 year or 6 months of time, we achieved maybe years of coronavirus work, which would have otherwise wouldn't have been able to. And I think in the longer run, governments should better decide on to fund science in general, because it might sound trivial at first, who's going to do the biology of how different genes work in such a virus. But when the time comes, that data is crucial for a nationwide program.
Exactly, yeah, very nice. I agree. I would even extend your observations into, you can now really good see which country is successful in managing the pandemic. It's a lot of countries led by women, I must say. And also it's those countries who listen to their scientists. We have several very well educated epidemiologists who are consulting with Merkel and the government, who is then giving out the new orders, and it was always fine so far. We are in a really good place. And New Zealand or other countries are even much better, but they are islands. They have different conditions. They can protect themselves better. But you can see how the US is going, what horrible situation we have in the US. You can see Brazil, you can see Russia and other countries where the leaders just try to silence everybody and act like it was not an issue. So the situation is horrible. And that's another finding. If we don't work together, if we don't help each other, if we don't listen to our scientists who have the knowledge, we will be in a devastating situation. And that's maybe a good closing statement from the both of us. It was a big pleasure to talk to you.
Same here.
And I hope we keep in contact. If we are again able to visit the countries of each other, you're very welcome to come to us, visit us, please, with your wife.
If you arrive in Canada, it will be great to talk to you again.
I wish you a good day and hope to talk to you soon again. Goodbye.
Thank you very much. Have a wonderful day.